So welcome to our SPX Talk in English. My name is Joep Pamen. I'm a board member at SPX. Our topic today is designing the future of health experience. And I'd like to welcome Lucien Engelen, who is a leading light on this topic. And he has kindly accepted our invitation. I think the reading of his bio and achievements could take the whole half hour we have in front of us. So I will therefore limit myself to saying that he is a globally recognized healthcare innovation strategist. He's a speaker on the topic across the world and CEO of Transform Health. Allow me to add, as I know this is important to our audience, that he has practical experience in acute healthcare. This interactive session will start with some initial questions that we have prepared, but afterwards we'll have time for any questions you may have. So we'll try to keep the initial section short. You can use the chat to ask questions or raise your digital hand. So, Lucien, thanks again for joining us. You have stated in one of your many talks that more healthcare is not the solution, more health is. Could you briefly explain what your view is on how hospitals can contribute to the transition from a sick care model to a more proactive health system?
Yes, of course, Joep, and thank you very much again for the invitation. As you know, patient experience is a topic very near to my heart. On an everyday basis. By the way, not only in acute healthcare. After my acute healthcare episode of 30 years, I transitioned to Radboud University Medical Center, where I created an innovation center, which was basically on the convergence of technology at one end and patient and professional experience at the other one. And after that, still helping a lot of hospitals. So my boots on the ground are being fed on a daily basis, and it's one of the things I like the most. Going back to your question, I think, first of all, we need to understand why I put such a hypothesis out there. At this very moment, based on all kinds of research, we see that the impact of healthcare on your and my health is only 6%. And that's where 90% of the budget goes into. So we know that behavior is the big chunk of it for people not becoming sick and ill. We know that where you were born, your postcode matters in terms of how sick you will become or your life expectancy and all these things together. So going back to that, I think that if we only would try to add more healthcare to it, not only we will find ourselves out of budget, that's one, we don't have the people for that anymore. In a small country like the Netherlands, just to give you an example, over the past 5 years, the number of admission rate for nursing school dropped 41%. So that's a crisis in slow motion. So first of all, I think we need to make sure that somebody gets into the basement and to close down the tap a bit more. With that, going from sick care to health care, to health actually. So I don't think that we should abandon personalized healthcare, of course, of personalized medicine at all. But what's about personalized health, personal health? So in that transition and that transformation, I think also the experience of patients/citizens in getting the right information at the right moment in time that they need it is all about patient experience. And I think that's where, given the new era of technology that we see right now with might be AI or might be remote monitoring and having interventions before you come into the hospital and afterwards is really something that we could do a lot of more work into, I think. So again, kind of wrapping that up, I think we will not be able to cope with the challenges that we face, budget-wise, personal-wise, demand-wise. So we need to make sure that we get as low number of people into our facilities as possible, giving the doubling in healthcare demand. So nobody will be out of job, but we will deliver more complex healthcare to more people that have more problems altogether.
Just pursuing that thought, Lucien, you coined the term healthcare user experience. How can hospital managers effectively integrate kind of patient-centric approaches into their healthcare innovation strategies?
Allow me to be teasing a bit, Joop.
Sure.
A question about patient centricity in hospitals. What else should be there than patient centricity? And I know we've been all working on that on a daily basis. But one of the things that was challenging for me, and also one of the things that I've done, is that back in 2015, within my University Innovation Center, I appointed the world's first chief listening officer in healthcare. And her only job, great lady, Corinne Janssen, her only job was to listen what patients would say to each other by sitting in the waiting room, by sitting at the kitchen table and asking, how can we help? And the majority of the small little signals and asks that came out of that kind of flabbergasted my clinical colleagues, because they said, wait a minute, this is not about the disease, it's not about the outcome, it's not about the treatment, it's about the process. And we often talk as hospitals about what we like to call patient journeys. Guess what? In my opinion, it's not a patient journey. It's a journey of a patient in a hospital, more often at one ward, maybe even at one physician or one nurse, while the actual patient journey starts at their home by gathering information, by coming to the hospital, by figuring out where to park, by figuring out routes within the hospital, by getting all your information. So I think the first thing that could be improved is to do an even better job at listening to patients and their informal care in what they need and how we could help them. And secondly, I also would like to add, we sometimes think about our patient experience as a hospital. It's not ours, it's theirs. So why not start by adding their perspective in every step that we take? Not once we got a strategy or once we got a process, right from the get-go, structural, by including them, and also making sure that you not only make sure that that is within the process, but also to make sure that you have unconditionally listening to what really is needed for it.
It sounds like a very holistic approach. You've also been a strong advocate for personalized health. How do you then see, many of our healthcare systems tend to be siloed. How can you actually match these two concepts or ideas?
Well, I think first of all, there's not one single patient. Everybody's different, and everybody has different asks or wishes or need for information. What we've done in healthcare for ages is that we would create one brochure, one protocol, one leaflet for all the patients and just throw that at them. While being a cancer patient myself, I had different information needs at different stages. So I don't want to be bombarded with all the information about something that is like 6 months out for me. I want to have all the information that's needed for me now to take the right step, the right decision, together with my healthcare professionals. So I think that's one aspect of personalizing health, getting the right information at the right moment in time and not being flooded by everything else. Second of all, I think based on what we're able to do right now with all the technological aspects like rings that you could wear on your finger that measures your oxygenation level and your number of steps and making EKGs and all these things, to include that personalized data of patients that's out there already by being able to include that within our clinical decision making, not as the one and only information. And we also need to make sure that we know it's user generated data, as we like to call it, but it gives sometimes strong signals about what happens. And just to give you one example with COPD, which I think is a good example of it, when the internist would ask the patient about whether or not they have been walking a lot, the patient would say, yeah, sure. But what's a lot? Until the moment in time when, for instance, your ring or your phone or your watch is sending the number of steps that you've been taking, you can see that there's a decline or actually an increase. So you have better informed decisions into that. So I think that's one of the aspects, and I think we could talk for hours about that, but it gives one example, I think.
So, Lucien, what you're talking about will require a lot of innovation and cross-disciplinary kind of collaboration. Given your international perspective, I mean, you've traveled very widely. Have you seen any striking examples of where this is actually working?
That's an interesting question I get asked a lot. Which country does it all the best? Well, guess what? There's not one country. There is some rocking stuff happening in data in Estonia. And I think the Nordics are very well prepared in terms of what's happening in prevention and these aspects. In Catalonia, in Spain, there's the aspect of elderly care being perfectly perceived into it. And if you travel to the Middle East or to the Americas, you would see different kind of things. So my assertion now is that there's great stuff happening, flux of things happening in every country. But there's not one place, even the blue zones, there's not one place where everything matches perfectly. And I would hope that we would learn more from each other. And I think that's also where these kind of initiatives like SPX, in the broader sense, bringing together from an international perspective what is happening and how could we help each other is so important. And I would hope and I would wish that more healthcare professionals and administrators would jump into that rather than jumping on a plane and going to the HIMSS conference as an example, where the only thing that happens, people try to sell you stuff. And we need to have a more dive deep into what is needed for that. And for that, I think patient experience perspectives should be the start of all of those journeys, as a matter of fact.
It sounds like music to our ears at SPX, and that's certainly what we're trying to achieve and help. We have one question we ask every single speaker on this series of talks, and that is, what does the future of patient experience look like for you, according to you?
I think first of all, I think we need to mention data. There in Europe is coming up a new legislation that has been ratified, the European Health Data Act, that gives every citizen, every patient the ability as of March 2030 to not only own, but also have the access on their phone of all of their medical records. With that, the patient is the single first source that has all the information available. You as a hospital might have the information of your hospital right now and maybe a bit from the GPs or the pharmacist, but it's scattered. So reason for stating that is that will give a completely revamp of the, let's say, power and authority of the patients coming into that new era. With that, there's a change of force where the patient has the ability to do way more than they do right now and becoming better informed because they can share that data with you as a hospital, even with pharma companies or with big tech companies, if you would like so. And that is going to change the dynamics, I think, fiercely, bringing the patient actually at the center of their universe, which they should be. It's the only stakeholder present in that whole journey, isn't it?
Great, Lucien. Thank you. We have voluntarily kept this part short, as we said in the beginning, to allow maximum interaction with the people attending this talk. So please feel free to either put it in the chat or raise your hand. I will maybe ask the people that have already put in questions to ask their question directly. I can, of course, read them, but I think it will speak a little bit more. So we have a question from Axel. Axel, maybe you could just quickly turn on your mic and ask the question.
Hello. Yes, I have. Thanks for inviting me, because this is really seriously interesting. I've been working in the UK, Lucien, and from what you're saying, we are in, I know this is a bit of a standard thing to say, but we are in absolutely violent agreement on all of this. Not disagreement, agreement. We're working on this for the last 14 years and managed to have some implementations. I created some software together with my two doctors to to have this notion of the patient co-creating, activated by engaging them in a way that's personal to them. This notion of you should lower your blood pressure, yeah, but that's not what people think about. People think about their life, and in fact, to change that blood pressure, you can't go and go and do do that sort of thing. You need to change your lifestyle a little bit more exercise, a little bit different way of eating. Small changes make a big change in your vital signs. So you need to engage them, to activate them. You can't just say you have to do this. So letting go of the clinical model. Okay, all of this works. We've achieved some awards for our customers and so on, the NHS customers. The thing is deploying this at scale. There are so many obstacles. How do I overcome that? We all together.
Well, that's the $1,000,000 question, Axel. Thank you very much, because I think the implementation is key in all of this. Before I get completely into the answer, tell me, and that's more like a rhetorical question, why we kind of roster out whole hospitals when a new electronic medical record system is getting implemented, and everybody needs to go through all kinds of courses for 6 weeks on a row, and everybody is being rostered out. And when we want to implement a other kind of innovation, the clinicians have to do it at the site, or maybe even at night, or coming in particularly for those kind of things. So this goes to how serious we not only do take innovation per se, but also the implementation of all of that. And I do think that still the boards underestimate the critical value of innovating in it. It's also seen whenever there is budget constraints and budget issues, the first thing that gets killed is innovation. Well, every entrepreneur, every business owner would say the first thing that you need to keep up is trying to innovate you outside of a crisis. So having said that, I think that goes into delocalizing healthcare is going to be key in the next 2 decades, because we in no way, form or shape will be able to cope with it. So some of the things that we do in hospitals and the GP offices right now will have to shift. And I even think into the retail aspect. And we've done some great trials with that already in the Netherlands. It's a program that I coined Healthcare Meets Retail, Health Meets Retail actually, where we see that based on new technology, we were able to do some of the things that we're now doing within the hospital scenes or at GPs, also can be done at the pharmacist or even at the supermarket if you would like to do so. And I think that is going to be the big shift, combined with the data aspect that I mentioned earlier on already, giving us the ability, because the change will not come from inside out, Axel, as you and I, and probably everybody in this call knows, the change will come from outside in.
Yep.
Uber was not invented by the taxi branch, and nor was Booking.com invented by the travel industry. The same is going to happen with healthcare as well. And that's why, and I've been around also with a lot of the big tech companies, health and healthcare is at least within their top 5, if not the top 3 of all their focus areas for the next 10 years.
That's right.
Yeah, thank you very much for reminding, because we have an audience mostly of people from hospitals. And so it's always good to have this kind of raising of awareness that actually the innovation may come from the outside. Rui, you had a question on your end.
Well, maybe we can discuss this later and then we can pass to Vincent.
Okay, Vincent?
Because we have other questions and then we can...
Okay, Vincent, you want to ask your question?
To me, it was not a question. I just put on the text a comment. That means I'm from outside. I really tried as catalyst transformer to help many organizations, and health is one of them. And I noticed, and I give a reference to a book that is L'Hôpital Apprenant from Michael Ballet, where it really shows that the most important thing is to have a mission that is shared between the partner and the hospital, the doctors, the nursery, the administration. As what kills the hospital is the administration. Administration does not save a patient. It has constraints. And in fact, whatever you will do with AI and all this beautiful innovation, it will not save. It's just a beautiful dream that does not eliminates inefficiency. So you have to tackle from inside, and if you do it from inside, all these elements will help. And I invite you to read this book and to really understand that outside, many industry has done this journey that the hospital should do. And if you understand, you will save all the things, and doctor, nursery, patient, everybody will benefit of it.
Yeah, I can only completely agree with you, Vincent, in that regard. And I think that the administrative burden now is around 40%, 40, where physicians and nurses did not sign up to their education and career to become a clerk. And that is what they have become. So I think that's one of the first instances where we can win the hearts and minds of those people by helping them in that. That's where technology comes in, like AI and all kinds of other things, regardless of the hope and hype aspect in it right now. The second part is indeed also to learn from different and other industries how to create that joint mission. It's not only joint mission, it's also shared values, I think, Vincent, because we can create this great mission and we can go in a strategy session and 15 of them and have this great statement. If we don't share our values, it's worthless. And I think there is a lot of work been done out there also in other industries. So yes, totally agree.
Thank you.
Any other questions? I'm looking.
Maybe I can ask one question.
Sure.
Besides this technology issue that sometimes is a little bit blurry in my mind about how can we create conditions for better patient experience at hospitals, I would like to raise another question about how we can really combine these experiences. How can we learn from hospitality? Because we talk so much about healthcare and hospitality. And my question is about how can we realistically learn from the healthcare, from the hospital industry. In the next 5 years, how do you foresee this kind of learning from the hospitality, how this will turn to improve the patient experience at hospitals?
Well, I think that's a great question again. First of all, off the cuff and not in random order, we need to assign people from outside the healthcare industry into important positions within healthcare. That's not to say we should run it like a restaurant or we should run it like a bank or whatever, but we need to make sure that we influx some of those thoughts and approaches into it. And still, we need to run a hospital as a healthcare facility and to improve the lives of the people. So it doesn't work to just assign a former CEO of a bank to a hospital. I think everything's been solved. So influx, I think that's one. Second of all, I think if we really would be able to embark on a journey together with our professionals in terms of what we could improve together with the patients and their families or informal care, that's where you see the opening up of the eyes. But what we typically do, we have separate journeys. We have a journey for the physicians and even a journey for the nurses. And we have a journey for the patients. Why not combine all of that? And that's what I meant earlier on. You need the whole system in the room right from the get-go, as opposed to taking separate alleys for that and then to hire a consultancy company to combine all of that in one spreadsheet, for instance. That doesn't work. So I think, having said that, combined with what patients are demanding right now, let's be honest, at this very moment in time, we do live, all of us, Rui, in an instant economy. If I order something at Amazon, like now at almost 12:30, I get grumpy if it's not being delivered by tomorrow. And that is also starting to be the case in healthcare, where people assume that they can get everything in an instant. And that's not possible. But there are steps intermediate where we can do a better job. The whole patient flow, the whole patient journey digitally, just as an example, can be hugely improved in many, many hospitals and other healthcare systems, I think.
Great. Thank you, Lucien. We have time for one more question. Heinrich, I see that you've put up your hand. Maybe you can unmute and ask the question.
Yes, will do. I'm calling from Hamburg in Germany. Thanks, Lucien. Fantastic issues you bring up. I wanted to go back to the example you gave of the marriage of retail and health. And already in Germany right now, there's some drugstores and some grocery stores that start to offer telemedicine and mostly testing. Those are the two. So on the one hand, I see a certain danger in that because obviously they might do that to attract customers and maybe sell something to them. There's also a certain fragmentation. Then there's so many issues, where do I go for that? Do I go to that doctor or to that grocery? But of course, the advantage is that it can be more preventative. It lowers the barrier. People actually can do more things in an easy way, and it puts responsibility to patients. What I still find perhaps missing, and that's my question now, that I still feel most people in their journeys are not really managing their journeys. They don't understand enough what it is they have, what they should be doing. So they need kind of an assistant, a coach with them. And I believe that AI can offer that to bring all this together, the retail, the new possibilities there. And so just the question, what do you think, what you see with this new marriage, retail and health, and is there still a need for somebody sitting on my shoulder and really telling me, what I should be taking care of?
Great question indeed. I think the twofold part of your question. First of all, the marriage between retail and health is going to happen anyway, if we would like that as healthcare or not. The new technology is coming up. I had the honor of presenting the very first autonomously blood drawing robot on stage live at a conference last January. Within 1.3 minutes, it would draw my blood and put a patch on my arm with one single living person just next to it. That is happening already in 15 hospitals across Europe, as an example, getting smaller by the day. And in the end of the day, it will sit at the pharmacy's office, just as an example. Second of all, I think they want to sell something to you. One of the things that they want to sell to you is that they need footfall. Due to the online aspect in the generic retail, they see less customers coming into their offices, and helping with health and healthcare could be one aspect of gaining people back into it. The third aspect on the retail is that we need to make sure that it's credible. And that's where we now see that telemedicine is getting into the mix with real doctors and real nurses at the back end of it. So I think that's new territory. I think within the next 15 years, that's going to explode. And in some countries, you already can see some of those. Your second part of the question is technology, like, for instance, AI, which at the moment sounds like AI is going to solve everything. Guess what? It's not. It's going to take a while, for instance, because every AI is going to be a medical device, needs to be certified and all these things. But in terms of guiding you through the journey, by being able to pull in all kinds of data from your healthcare institutions that you collaborate with, from your retail institutions, maybe even from your work and your personal data, that's where AI, as in AI agents, are coming into the mix. And that brought me into a slide in my keynotes that AI in the next 5 to 10 years is not only going to disrupt all of the portals that we have in hospitals, because nobody needs them anymore, because they're pulling in their data, but even is going to disrupt the EMR industry, like the Cerners and the Epics of the world. Because with that, there is no need to go into the portal anymore. There's no need to go to the website. I have my own app where all of that data is going to be combined, is going to sift through, and somebody is going to guide me and say, the most people that have experienced this have taken that route or that, and that's the pros and the cons of that. So I think, yes, it's going to help technology, but again, we also need to be mindful it's going to take a generation, because in the educational system for physicians and nurses, it's still not embedded.
Thank you. Great answer.
So, Lucien, we have run out of time. It's been a fantastic journey. Thank you very much. And sorry for compressing. I have the feeling that we could be talking about this for hours. But again, thank you very much for this short session. I have some public service announcements still to give. There will be no talk in English in December, but there is a very interesting talk in French on the 3rd of December, and it's actually based on a concept which is close to the hospitality sector. My Hospital is by Valérie Loisel and Alena Soré, who works at the Foch Hospital in Paris. I also have to remind you that you have till the 15th of December to submit your excellent patient experience projects for the SPX award. So please do so. And then finally, you can find more information on all of this and our other talks and activities. And a replay of the talk will also be available through our website and our YouTube channel. So thank you all. Thank you very much, Lucien. I hope you enjoy the rest of your day, and I hope to see you soon. Thank you.
Thank you again. Bye-bye.
Thank you. Bye.